your sports at this hour. Now, the global hand washing campaign is set to kick a start in a few days. We're going to talk about that right now in our lifestyle segment right here on Morning Express. And this morning, I'm joined by Kefa Ombacho, who's the Chief Public Health Officer in the Ministry of Health, as well as Gitahi Dwita, who's the Acting Senior Deputy Director, Basic Education. Thank you both for joining us this morning. I'll begin with you, Mr. Ombacho, to just help us understand what this global hand washing campaign is.
Thank you very much. Global Hand Washing Day is a global day set to actually upscale issues of hygiene and sanitation globally. And this day was set aside because of the tremendous assessment which was, the assessment which was made, and it was realized that there is tremendous risk associated with poor sanitation and hygiene globally, and more so in developing countries. And so the day was set aside so that it can be observed globally as a way of actually trying to mainstream the area, and actually trying to remind countries and populations globally about the need to improve in their behavior and of course their hygiene and sanitation practices. Okay,
Futa, let me bring you in, because when you hear Global Hand Washing Day, he's talked about hygiene and sanitation being some of the key things that this day seeks to educate people on and remind them of how important it is. But when you hear Global Hand Washing Day, people just imagine it's about talking about washing hands purely. Is that the case?
It's not just about washing hands. Also, washing hands is part of hygiene and sanitation. It's about improving one's health, because washing of hands alone, we are told, helps to eliminate a lot of ailments associated with germs and that kind of thing. And that is why we're starting with schools, because children are good ambassadors. They are able to reach every household. But it's also about good habits in eating, in doing all other things.
All right. So what is going to be happening this year? Can you take us through the dates, the date when this day is happening, and what is expected to happen, where it will be?
Okay. The date will be on 15th this month. The venue will be within the Machakos County, Mwara Sub-County, in a school called Makutano Primary School. Basically, this year's celebration will be the 6th since the UN set aside the date. And what will happen is that we will have a number of schools participating, drawn from within the catchment area, and those who are interested to come from either far and around. And the big thing that will be done during that day is the action of washing hands by a number of children. Globally, this is done starting from 11 o'clock. And I am sure you are aware that as a country, we are the ones in this part of Africa working with the other sector actors, both government and private. Previously, we have done very well, and we hope to do the same. But we know that more needs to be done. But in terms of what is in the Guinness Book, I think as a country, all the actors we have done previously well. And the children will be actually washing their hands with soap. That act is actually supposed to be sending some kind of reminder to all the people of this country that there is something that needs to be done. We are all aware that globally and as a country, there are quite a number of Millennium Development Goals that we are supposed to achieve and attain in trying to reverse the ill health into good health. And one of them is actually the reduction by two-thirds the number of deaths of the under 5. I think in normal ways of life, one would not be able to connect the mere act of not washing hands and the hazards and the disease causation.
Okay. All right, let me bring in Rita, because we're talking about the hazards and the diseases. What are some of those ailments that one becomes prone to when they do not practice hygiene?
Yes, we have a lot of diarrhea and diarrhea-related diseases. We have pneumonia, which is associated with bad hygiene habits, and we also have respiratory infections. And we are saying that washing hands, and not just washing hands, because washing hands without soap is like wetting your hands. But when you wash hands with clean running water, you are able to eliminate a lot of these ailments. They say that you can eliminate 25% of respiratory infections through the washing of hands. And like my friend says, the children are mostly affected because their immunities are quite low. But we are also talking about good hygiene practices, that if we mentor our children to start doing that, and it's become part of their lifestyle, we'll have a healthier nation, because as they grow up, they will have acquired that critical habit. And I think we are saying there are critical times that we need to remind everybody before meals, when you visit the toilet, when you are bathing. It's important to observe that you wash your hands with the soap and running water. I think the issue of running water is there are times when people are washing from a same, and so you are like pouring germs in a container and everybody is repeating that. And that is what we are saying, that we need to wash your hands with running water and soap. And I think you'll be able to.
I like that you're bringing that out, because we see a lot of that happening. There's this basin of water and everybody is just washing their hands. So by the time it gets to the fourth or fifth person, really, they're just also gathering some of those germs. You're talking about running water, and also some of those instances after visiting the toilet, before eating, before handling food. Are there other instances that are very important?
Changing clothes.
Changing clothes?
For kids.
For children, okay. Any other instance?
I think basically those are the very critical points that, and of course, for our country, after coming from the farm, I think most of the people just go straight to eating. I think those are critical areas that we wish people to observe. And just like we are saying, some research will just be done in this country. We realize that availability of soap is not a problem. 90% of our home states have got soap, and yet washing hands using soap becomes number 4 in terms of priority. And while we are actually aware that if that is done, we will be able to eliminate quite a number. 50% of all diarrhea-related diseases can be eliminated by just a mere act of washing hands with soap.
And what kind of soap? Without, of course, mentioning brands, but soap, any soap?
Actually, there's no question of even any brand. What we are actually asking is any soap, anything that can gives any forming material. Is able.
What does it do?
Our hands, normally, when you look at our hands, there are grooves within our hands, and the grooves is where the germs are embedded with a bit of dirt. So when you first wet your hand and use the soap, the action actually makes the grooves to ease the embedded germs and the dirt. And then when you squeeze and clean your hand with the running water, that dirt with the germs actually gets out, and the chances of it all is reduced. So the amount of the germs that you are supposed to be taking while you are eating without knowing it is tremendously reduced by mere washing hand with soap.
Okay.
Yeah.
And Dr. you mentioned some of those diseases that one could get the effects if you do not exercise or practice hygiene, and some of them are killer diseases. I'm talking about pneumonia. It's very serious. So this is a very important subject that whilst it might sound simple, wash hands, but it's very important because it's if failure to do that, then there are quite some consequences, and deadly at that even.
Yes.
Yeah?
Yes, they are actually quite serious. And I think we are saying we have an opportunity to reduce the costs because like my friend says, soap is easily available. So just acquiring that habit. And for us in the education sector, we have seen a lot of outcomes, milestone in education. It improves the learning abilities because children are healthy and therefore the quality of learning improves. We are also saying that children have the habit of playing with the soil and and therefore acquiring a lot of germs. For example, the soil transmitted helminths, the worms which are passed through. And so we are saying in this year that health is in your hands. Wash hands with soap and you live a better person. Even for mothers, when they change the diapers and that kind of thing, you have an opportunity now to make sure that you and the health of your child is improved.
Okay.
Yes.
Is there a theme?
I think, yeah, we have a theme. And the theme is the power is in your hands.
Okay.
But just to come to the issues of the diseases, I think basically we are targeting two diseases. We are targeting pneumonia and diarrhea-related diseases. As you are aware, pneumonia and diarrhea is actually the two major diseases that actually cause the hospitalization of especially the under 5. And of course, even in they also, like pneumonia accounts for, diarrhea accounts for 16% of our deaths in this country. And in every 1 year, we lose about 30,000 cases of at the under 5, and I think that's quite a huge number of life that we cannot afford to lose. And respiratory infections. Basically, if the practice and the behavior is inculcated in the children and the communities and the people in this country, what it means is that we are going to reduce by 25% all the pneumonia-related diseases and 50% all the instances of diarrhea-related diseases in that big context of the disease burden in this country. And in terms of economics, I think that will translate into us as a country reducing the cost of treatment and hospitalization, and of course also making our people available to be able to venture into the economical development of this country.
Okay.
Yeah.
Our time is up, and I want you to make your closing remarks. I'll begin with you, Thuita. I like that you have mentioned, and perhaps just to reinforce that it goes beyond just washing hands. It's basic hygiene around the house, around the office, wherever you are, just ensuring that your environment, you hygienically serve. You're just making sure those elements are looked at.
Yes, and we are also saying that we want to use our children as ambassadors. And the strength of that is that children can reach every household, and they have the ability, from what we have seen, to talk about issues in a passionate way, especially if they are something that they have been taught as habits. And we are saying that when we acquire this habit and the children grow with it, even the adults will be able to acquire that.
Okay.
And I think there is a very good joint venture between health and education.
Yes.
Because it's a very, very strong message. We are mentoring children. Some of them we call the ambassadors, retail doctors, to transmit this information, because we know, even from education, that prevention is better than cure. And we would want to take the advantage of preventing before we go into using a lot of money and resources into curing those ailments.
All right, thank you very much. Your final statement as you remind us that date for those who may have just been joining us for the Global Hand Washing Day.
Thank you very much. From the Ministry of Health perspective and the country, we want to welcome everybody to participate on 15th at Machakos, Mwara in particular. As a Ministry of Health, we are committed into trying to reverse the trends and improve the health of the people. And indeed, it is in line with the Vision 2030, where we are supposed to reduce the number of deaths by 2/3 of the under 5. And it is also in line with the Constitution, where we are supposed to actually, where it requires every Kenyan to live in an environment which is actually at the highest standard achievable. So, and in line with also our ministry's national health policy, where we believe that we need to promote preventive health as one way of actually sustaining good health for the people in this country.
All right.
Yeah, and for the sector actors who work with us, we want to encourage them to work with us as a ministry and as a department, because we believe together we are responsible for giving people good health in this country.
All right. Kefa Mbacho, Chief Public Health Officer, the Ministry of Health, and Gitahi Duita, Acting Senior Deputy Director, Basic Education. Thank you both for being with us on Morning Express this morning and talking with us about the global hand washing. They're very important, and I'm sure those of our viewers that have been watching this morning have a better understanding of how important it is to make sure you wash your hands. Remember what the Daktari said, running water, using soap, and also after visiting a toilet, before eating, before handling food, changing the baby, just always keeping those hands clean. Very important. It is a good preventive measure to very many diseases and infections out there. You are watching the Morning Express. We'll now take a short break. We still have entertainment news to come, and also we are talking books as well. Stay with us.